So the purpose of the 100-day challenge is to take an area of the country that's been piloting IPC, Integrated Personal Commissioning, and really try and leap forward with the whole model. And the idea in Stockton was to see whether they could get all 5 key shifts working across a number of areas in a rapid timescale.
All of the teams were focused on frail older people for the challenge. So actually all of the work was saying, how can the model of integrated personal commissioning shift lives for older people? So where we landed in terms of the design was 2 teams focused in the community, one in central Stockton, so a relatively deprived area, another one in Billingham and Norton, which is slightly more rural, and then a 3rd team that was focused on actually for people that do end up in hospital, how do we start to take a different approach that builds in elements of integrated personal commissioning in a hospital setting.
For our hospital team, our focus was on safe and efficient hospital discharge, and we've tested out over the next 100 days different cycles around how we can improve what we do. And initially, right at the beginning, we had lots of teams working in silo, and what we've tried to test out is where's the duplication in the system, or how can we work differently, how can we test that out. Some of the key results for us are around producing a high level vision for an integrated discharge team and what that might look like, and then the added benefits that that can have in terms of reducing delays in the system, but ultimately providing a more personalised approach that is about the person and not about our processes.
One of the things that we decided to test was education sessions for professionals. So what we did was people with the knowledge and the skill and the passion behind it went out to kind of spread the word, if you like, among other professionals. We got a lot out of those meetings because you get to see things from another side. So from social care, for example, one of the things that we would always be looking at is what can we do to support this person to stay in the community. But we look at that very much around what support can we put around this person to get them to stay in the community. And then you've got health professionals who are very much focused on the problem at hand, you know, what's wrong with you, how can I help you fix it? But sitting down together and looking at it from a holistic point of view, actually, we're kind of duplicating things that are already there. What we needed to do was take a step back, ask the person what they wanted to achieve, and as professionals look at what we could offer them.
And the data that we managed to pull was that there were more people attending A&E between 5 and 8 on an evening than any other 1 hour during the day. What we did was we integrated a health service with a social care run service in order to provide a service out of hours for patients that were going into crisis in the community.
It was very beneficial to have everybody in the same place at the same time, and an idea to come out is actually to keep that going is a co-location. We actually need to work together, speak to each other away from the computer, have the conversation with the patient, underpinning principles of how we move forward.
So we got involved from the voluntary and community sector to really be the link of what was happening in the community. We have funding from the CCG to run some of our projects, and the ballet was one of them. And it's people having the confidence to use the sector appropriately. I think it's been the biggest achievement within our group.
It's given us freedom. We have been trusted to get on with it, try things differently.
What we've shown is what we can create through this is a much more efficient process that builds in more quality to the individual.
I'm now getting to the realisation it's much better to have an open conversation. It's much better for the patient, the client, the person to lead the conversation, and then I can just absorb the information. I'll really truly learn what's more important to them.
There's this real sense of momentum amongst the teams. You know, they are categorically saying, you know, we're not done, we want to take this forward, you know, here's what we think the next steps are.
It's a lot more than just this 100-day, it's what we're going to do after that. It's around us not thinking about being in separate teams, it's about us being one big team.
Stockton is in a fantastic place now, locally, to roll this out across Stockton into Hartlepool, which is the whole of the CCG. And we've heard this a lot today, is that this isn't the end of 125 days, it's the start of the next 1,000, and what can they do locally to build on their fantastic start.